Hi, I'm Dr. Leslie Blevins. Thank you for visiting my website. I'm trained as a school psychologist and a board certified behavior analyst at the doctoral level. That means that my training involved many children and adolescents from 2 years old through college age. It particularly focused on assessment and therapy. It had a strong consultation focus. I worked with many teachers. I also had training in a pediatric setting, working with physicians. I believe in a team approach due to my training. My training also had a very strong behavioral focus. And what that means is that rather than thinking of a person in the context of their diagnosis and thinking that anybody with that diagnosis might respond the same to a specific treatment, as opposed to that, I instead really focus on identifying the specific pattern of behaviors that the person comes in with and identifying the different context in which they demonstrate those behaviors, their strengths and their weaknesses. And then I use that pattern of information and behaviors, and I create tailor-made interventions. And then I collaborate with the significant others in the person's life, especially with children and adolescents, but also with adults whenever they wish to include significant others, so that the intervention is as comprehensive as we can make it. My intervention approach includes a consultation at the beginning. This is typically done on the phone, but I can also do a 30-minute consultation in person, where essentially I allow you to vet me. I ask you to ask as many questions as you can. I also tell you more about my approach. Typically with children, I work with children 2 to 9 years old. It involves a very strong behavioral training component for the parent, because I believe that the parent is ultimately going to be the Jedi behavior master and the therapist. And my goal is not to be in a long-term therapist role with your child. I don't think that that's super effective, but it's more to give the parent the skill set so that they can then do very therapeutic approaches at home on a day-to-day basis, very intensely with their child, so that the improvement in behaviors is as efficient as possible and as comprehensive as possible. And after the consultation, we do an intake. And during the intake, we really focus on what difficulties are happening, the different context. We develop a plan. The plan might include comprehensive assessment. During comprehensive assessment, I would give different kinds of tests. Some are normed-based, which means that I compare the performance of the child or adolescent to the performance of other children and adolescents of the same age. Some are criterion-based, which just means that we expect mastery to be at a certain level. Have they reached mastery or have they not? And then at the end of assessment, which looks at a variety of different domains like intelligence or language, behavior, anxiety, depression, writing ability, math ability, all kinds of different things. At the end of the comprehensive assessment, we can have more insight into what the difficulties might be. Then we can do a tailored intervention approach. The comprehensive assessment isn't always needed. Sometimes people come in already having one that's relatively recent. Sometimes the diagnostic picture is really clear based from the intake, but sometimes we need it. And using that information, we can create an intervention plan that is comprehensive, and together with the parent or the individual, we come up with the plan and we begin implementing it. I like to do a comprehensive approach rather than doing just in clinic sessions. Sometimes I will go out to the school and train the teachers. Sometimes we might do out of session treatments, especially for different kinds of anxiety disorders that might require actually going, outside, experiencing something that is kind of aversive and scary. And so to have the most evidence-based and effective kind of treatment, we have to kind of think outside the box. And that's the kind of treatment plans that I like to do. For my adult therapy practice, I don't do assessment for adults unless it's something that has to do with developmental delays or even learning disabilities or ADHD, something in that field. But otherwise, what I do focus on is chronic health conditions, such as chronic pain management, smoking cessation, weight loss, diabetes management. I focus on the behavioral management components of those types of things. I mean, the list isn't conclusive that I just gave you, but what I like to do is help people to find their life again. Many times they find that they might be spending all of their time, especially with something like chronic pain, they might be spending all of their time really managing and avoiding having pain episodes. And so the approach that I take is one where we start to trying to find meaning in your life again and engaging in activities that give you joy. And it's a really, really, joyful experience for me as a therapist. I like to do group chronic pain activities so that you find a peer group where you start to reduce the feeling of isolation that you might be having. I use very behavioral approaches for many of my illness-related therapy strategies. So for instance, with smoking cessation, I like to use behavioral strategies there. I like to use mindfulness approaches. I use acceptance and commitment therapy, or ACT for short, in order to help people to develop and really hone in on what's important to them, and to also start to develop an understanding of how smoking and other health-related behaviors might be feeding in to an avoidance of actually seeking out what's so important to them in their life. And then finally, I like to focus on physician well-being. Part of my training was inside primary care, and I feel like I really developed a passion for helping other healers to be at their best. And with our health system here in the US, I just really feel very strongly that the healers have to be living out their values and taking care of themselves in order to give their best to their patients. And so with the insights that I developed working alongside my colleagues, it's a goal of mine to utilize ACT, especially with physicians and with other medical providers, in order to help them to feel good and healthy. All right. I'm so glad you're here. Keep exploring the site, and please give me a call. If you have questions, I'm happy to answer them.